The name of the team is REMAP for Kids. It stands for Reverse Molecular Pharmacology in Pediatric Oncology. So the idea is to do pharmacology in a different way. So we use drugs that are already existing. So they're either approved drugs that are already on the market or drugs that are in clinical development at the moment. And we're going to use them as tools to better understand the disease we work on. So we'll use screening techniques. So we'll use robotic screening platforms to screen a lot of different drugs. And then when we find a drug that's going to be working well in a given cancer, we're going to try to work our way back up to understand why this drug is working in this particular cancer. And that leads us to identify new vulnerabilities in those cancers. So the specificity of our team is that we work especially on childhood cancer, because the team is led by myself and Professor Nicolas André, who is an oncopediatrician at Latimon Hospital. And so we focus mostly on pediatric cancers that are very hard to treat. So for instance, the cancers of the nervous system, so either central nervous system, which is basically the brain tumors, and also the peripheral nervous system, which is a tumor that is called neuroblastoma, which will affect the peripheral nervous system, and you can have tumors basically a little bit everywhere in the body. So we use those drugs to better understand those diseases, and so that we can come up with new treatment, and especially combination treatments. That's what we try to develop in the team. The reason we're focusing on childhood cancer is because it's a very rare disease. It's only affecting 2,500 children per year in France. So that's a small number said like this. But the thing is that we lose almost 500 children from cancer every year. And the thing is, childhood cancer is very different from adult cancer. Adult cancer is a disease of aging, basically. It's your cells getting old and the accumulation of mutations. Whereas in the case of childhood cancer, it's a disease of development. Basically, something goes wrong between the embryonal development or sometimes a little bit later in life. But they have fewer mutations, they have less infiltration of immune cells. So when we try to transfer what has been done in adult cancers to childhood cancer, we get some success, but there's a lot of failure as well. And we think, and we're not the only one to think that we've reached the limit of this model of just simply copy and pasting discoveries that are made in adults to the children. And we need to develop dedicated research program for childhood cancer because we need to target those specificities. And so that's what we're trying to do in the team, and that's what we're very passionate about, that focusing on those on those specificities of childhood cancer will really help to save more children that we are saving at the moment. The CRCM is 50 years old, but the departments are brand new. We're kicking off the creation of our new department. So it's a translational research department. It means that we are the teams that are trying to transform the fundamental research discoveries that we make in the lab into the clinic. And so it's very important for us to work together because we have different expertise that are very complementary, and we're going to be able to help each other out. Basically, we are very, very close to the clinic in my case because I work with a clinician who is in charge of clinical trials. So we're very at the end, so we can help the other researchers that maybe are a little bit earlier on the process to give them some tips and advices on how to progress to the clinic, and vice versa. Some of the people in our department are very good at developing preclinical models. So we have organoids that are being developed by some teams, and some others are developing animal models that we will then be able to benefit from and use in our own project. So this collaboration between teams that are working in the same area and the same theme is very important to stimulate collaboration for the young researchers in our team as well, to interact with each other and maybe give each other advices and help each other out. So this is going to create a real dynamic towards the translation of our findings, and it's going to be very beneficial, I think, for everyone.